leadership, even if they're not writing checks. They're influencers. They're the boots on the ground. They know the community. So we've done this in small communities in the Midwest of 15,000 people. We've done this for 140,000 people in the beach cities of California, Fort Worth, Texas, over 1 million people in a Blue Zone project there. That's more like 6 Blue Zone projects because there's 6 very different neighborhoods and large employers. And the results, they are a little bit informed by what the community needs. You guys are already doing this work, boots on the ground. So it's not looking to duplicate or be redundant, but where can we provide lift? Where can we provide some alternative measurement and some differential impact? So about $500 million of follow-on grants, reduce stress in a community that's way stressed out, like Southern California, 140,000 people, lots of traffic. We did a Blue Zone project for the schools across this 140,000 total population, and they reported a 55% drop in childhood obesity. 55%, that's a big number. And then a $72 million in medical costs and lost productivity savings. Fort Worth, Texas, over 90,000 residents got engaged with Blue Zones as either volunteers or participating in one of our field events, and over 500 organizations became Blue Zones approved. And then one not-for-profit health system that sponsored a Blue Zone project in Southwest Florida, they Blue Zoned their work site, 4,000 employees. CFO recorded a $27 million reduction in self-insured medical claims for just their 4,000 associates. That was written up in the New England Journal of Medicine. All of these have in common a 5% sustained improvement in well-being. So we measure 3 things when we come into a community and baseline it. Number 1, the disease prevalence. We look at 11 disease risk factors, and we know that those 11 are indicative of about 120 other risk factors. So if we're moving the needle on those 11, we can be really sure that we're moving the needle on all the risk factors. And the 11 are things you would think of: obesity, self-life evaluation, hypertension, smoking, cardiovascular disease. There's 11 of them. The second area that we measure is what's the economic expression? What's the output in dollars and cents of reducing the disease profile of a community in terms of medical cost savings and productivity boost back to the community? We can actually quantify that, and we validated it 62 times. And that's part of the way that we get the private sector to pitch in on dollars and cents and like-kind support, is because we make a validated case for why there's economic impact here, why the mayor should get excited about this, the hospital and the health insurers and other major employers. The third area that we measure is a little bit squishier, but I'll tell you the science on this is the most exciting thing about anything else that we do at Blue Zones. World Health Organization and Gallup organization partnered over the last 12 years to conduct the single most comprehensive survey analysis around the world of the well-being of humans. And this survey gives us a lens into 98% of the world and how they experience well-being, including Mason County, because they get so granular down to that level. So we'll baseline what is the current well-being of Mason County. Now, well-being and wellness are 2 different things. Wellness is physical. That's the physical dimension of well-being. It's important, but you can't create a predictive model based on just moving the needle on physical well-being. I could have a 6-pack, but I could have financial stress. I could have social isolation. I'm not well. But what Gallup and the World Health Organization have told us is that if you can move the needle for an individual or a population on all 5 dimensions of well-being, physical, community, financial, social, and purpose, you can create predictive analysis and manifest outcomes in a community. So obviously, as you can imagine, when you improve the 5 dimensions of well-being on a scale of 1 to 100, this is the Gallup scale, 1 to 100, 1 is really bad well-being, 100 is very good well-being. For every point of increased well-being on this scale, you see a 1% reduction in total healthcare costs and a 2% reduction in hospital and ER admission. I believe all healthcare in America is paid for by 2 groups of Americans. American workers, because of lower employment or lower wages, and American households in terms of higher taxes or generational debt onto our kids. The end of the line, all healthcare is paid for by 2 groups of people. So by removing total healthcare costs by 1 point, I don't see that going to the bottom line of hospitals. I see that going to the bottom line of Americans. But here's the thing that I think is really exciting about this science is it doesn't have just health outcomes. But when you can improve the social well-being, the financial well-being, and by financial, I mean how people manage their money, the community well-being, are you proud? Do you feel safe of your community? The social well-being, do you have people you love and friendships? Purpose, do you like what you do every single day? It creates business outcomes. It creates community outcomes, lower crime rates, higher graduation rates, lower teen pregnancy rates, and mental health outcomes. Obviously, you improve the purpose and social and community profile of community, you're going to see lower rates of clinical depression. So that's the third thing that we measure is the actual experience of well-being, which we believe has manifestations. Here's the last piece, and I'm going to wrap up. So those of you that work in public health, you know the importance of community engagement, getting the community engaged, getting partners and stakeholders to jump on the bandwagon. Blue Zones has done a lot of work around building up our sex appeal when it comes to public engagement, population health. 3 New York Times best-selling books, 3 National Geographic stories. Here's something people don't know. I don't even know if Gene knows this, but my father recently signed a 3-book contract with National Geographic, now owned by Disney, for 3 more books. They're going to drop in the next 5 years. And the tactical value is that every time he drops a book about blue zones and well-being, it's all over the national media. It's a tour of the Today Show, Good Morning America, 60 Minutes, Fox News, CNN. The tactical value is as our 200 current employees in the communities today wake up and they're trying to advance critical mass of people, places, and policy, and celebrate the milestones, celebrate the partners, those people that they're trying to serve go home. They're going to open up their laptops for the next 5 years. They're going to turn on their TVs for the next 5 years, and they're going to see more blue zones there, which we think is going to help with engagement. Even in the year of our Lord 2020, with a pandemic and social unrest and an election, we were still able to put out positive and inspiring stories about Americans' communities coming together to transform themselves. And I'm going to stop there because I think I've used up my time. I'm happy to answer any questions, but I want to respect the rest of your minutes. But I'm very excited about partnering with Gene and Choice Network and Mason County to advance this work in Washington.
I had a couple questions, if I could. So you mentioned the schools, and here in Mason County, we've done some after-school work programs, things like that. And I came from California, the same thing issue there. Some of these kids, the best meal of the day they're getting is at school. And so, I mean, without going into, I get it, we're diving deeper now, but how do you impact the family that sends the kid off to school and the kid's best grocery shopping is 7-Eleven or AM PM?
Yeah. Couple things. One is when we come into a community, the first thing we do is listening. So we do a site visit and assessment so that we can learn about the work that's already being done and what are the challenges. And we send in our national experts to do that listening and to have that brain trust to offer you guys, partner with you guys. From my experience, there's some best practices around policy. There's some best practices around engaging municipal leaders who control the purse strings and convincing them that this needs to be part of an informed master plan, and that there's Blue Zone Project community upswell behind that informed master plan, so that certain dollars and cents and attention to policy is diverted from more traditional places and focus on a challenge as specific as that one.
So I got one more follow-up to that. I don't want to hog everybody's time, but so you mentioned the diseases and you mentioned smoking in there. Right? Would you count addiction into that as well? Because like other places in Washington, especially, we have an addiction problem. People self-medicating themselves here with legal and illegal narcotics. So does that come into the formula at all too?
Yeah, so historically, we've not been a rifle shot approach to disease in communities. So we come in and it's kind of a silver buckshot. We look to move the needle on all disease risk factors, and mimic what we saw in the blue zones. When it comes to addiction, we're not the experts on that. But we believe that by elevating the Power 9 purpose, connecting people, putting people in right tribe, implementing policy around tobacco, alcohol, food systems, built environment, and then reaching out to the places in the environment where people hang out, we can start to reverse the tide of that. We have a sister solution called Starling that was recently piloted in a community that had high diseases of despair in Northern California. And that would be something that after a listening session and an assessment was identified as a key need, that would be introduced as an option.
Dan, I have a quick, yeah. Sorry, Peggy. Dan,
That's
just
okay.
a question for you. Two questions, I guess. One, if it's possible, could we get a copy of your presentation? I'd like to review that a little bit more, and I appreciate that. But was curious if you could talk a little bit about your program and how it might incorporate elements of trauma-informed care and ACEs. I think we have a community, not unlike many others, that have a high rate of ACEs in the community, and just was wondering if you could speak to how your program might be addressing some of those issues as well.
I'm sorry, could you tell me what ACEs is?
Adverse childhood experiences.
Okay. I'll be honest with you. This conversation would be much more valuable to you if it was one of my national experts, because I'm just not the technical expert in those best practices. So fortunately, I don't have a really good answer for you, but I'd be more than happy to send you the presentation, as well as connect you to 2 or 3 of the people on my team who could go a full 60 minutes with you on ACEs.
Perfect. Well, I'd appreciate that. Thank you.
Any other questions for Dan? And I guess what I'd like to know is, where do we go from here?
Really happy you asked that question. Again, I am Jean Clark, and I am the CEO at Choice Regional Health Network and also at Cascade Pacific Action Alliance, which is one of the 9 ACHs in the state of Washington, which is your ACH for the state of Washington. So hopefully CPAA is not a foreign 4 letters to you, and that you're well aware of Cascade Pacific Action Alliance. Choice Regional Health Network has really dove deep into blue zones. They are an organization that is members only, that is really invested in making sure that Mason County particularly has the best well-being index that they can have. And we have been looking at blue zones for a number of years. Cascade Pacific Action Alliance, your ACH, has some dollars, and they have agreed to spend their wellness dollars on this particular program. And so there'll be 3 counties that will be launching with blue zones in 2021: Grays Harbor, Mason, and Lewis. And so you guys are the front runners for this endeavor, with a large portion of it already paid for by Cascade Pacific Action Alliance. So we are going to be able to really take you down this path, hopefully engage many, many community leaders. Dave has been attending a few meetings. I don't know how much he has shared. This is, pretty new on the agenda. So if you're a little behind, it's not Dave's fault by any means. Hopefully he's been sharing bits and pieces as it's been coming forward. But we are super excited to be able to really start to share with these communities our adventure moving forward with blue zones.
Dave, do you have anything to add?
Well, yeah. So if Gina will back me up on this, when I saw the first presentation, I was pretty hard on the poor folks in blue zones. I had
I'll
some,
second that.
I had some very serious questions and really put them on the spot. And Eric Mola and I were laughing about that the other day, because I was really pretty tough. But I really wanted to know some details. I wanted some realism put in here. And what kind of turned me around is I was kind of not really in favor, but as I got to researching it and then looking at where I see health in the future, the only way we can bring the cost of healthcare down is to keep people from being sick and in the system in the first place. And what this program does is it builds a culture around everything that's involved with health, housing and economics, and it's not just a public health in the traditional sense focused project. This is like taking our coalition and really giving it a base. We're trying to do this already. This is just a very programmed, very logical, very decisive way of moving forward. So I think that our coalition, backed by Mason Matters, which we're standing that back up again, I see us building a mini ACH and blue zones as being the operational arm.
Okay, I think that kind of answers Dan's question to us also, is that Mason Matters will kind of facilitate this. Is that what you're saying, Dave?
Yeah, I see Mason Matters as being kind of the backbone of this whole project and the community coalition. In much the same way, the Choice Network is the backbone behind our ACH, and our ACH is the backbone behind blue zones in the 3 counties. So I think it all dovetails together very nicely.
Discussed it this morning at the hospital board meeting, exactly what you're talking about, Dave. And my concerns were Mason Matters, I know, went through some bumpy times and some executive director issues, but Derek told me that that's behind them. They're trying to reformulate the board, for lack of a better term, and stand it up back to what it was originally designed for.
Okay. Any other questions?
Yeah, just one real quick question. So, Jean, you mentioned that some or most of this would be funded through Choice. What's the other funding piece, and who's responsible for that, and what's that cost look like?
So we have enough dollars to start us off with the initial contract, and we will be doing fundraising throughout the course of this. So Choice will take that on behind the scenes. We will be looking for funders throughout the process to continue with it. I mean, this is not a 1 year and done type of an initiative. We're looking at probably 7 to 10 years to have this continue at minimum with assistance with the Blue Zones team. And as Dan said, once you get to a certain level, it perpetuates in your own county by itself, and they can back out, but not until it's secured. And so part of what Blue Zones will help us with is looking for some grants. We, of course, will write for them. I am not concerned about finding the funding. I am more concerned about finding the right product and the right way to get our communities healthy. And we believe that we have stumbled upon it, you know, looking up the research and finding out really what can be brought forward. And so we will do our part to continue to find the funds to bring it forward for as many years as we need to.
Sounds
you're not
great. Go ahead.
Sorry, so you're not anticipating a county upfront contribution at this point?
If you would like to contribute to it, we're not going to say no, but is that on my list of things to do on day one? No, it's not.
Okay.
I think Kevin just volunteered the county is what I heard.
That's
I
great.
thought the hospital was going to pull the checkbook out.
You know,
There's
there's
the big check presentation.
there's lots of possibilities, and I wouldn't write out the, you know, the hospitals or other large businesses contributing to it by any means. Is it mandatory for someone to contribute? The answer is no. But I think as we move forward and as you see the value, I believe that businesses will come together and say, we do want to contribute to this. But is it mandatory? Will you guys be left out if you don't? The answer is no, because we want what's best for the community. It took, what was it? Dan, maybe you can help me. It took 8 years for a hospital system to agree, and now they are a large funder. I can't remember who it was. Gosh, I spoke to them in that state too, and asked about funding, et cetera. And was it Cigna maybe? I can't remember. I'd have to go back and look in my notes, but
What state?
it was, oh gosh, what was her name? It was like the second or third one you brought up.
Okay.
It was in Michigan. I want to say Michigan, Minnesota, excuse me, Minnesota.
What was your question?
There was a hospital system that was very reluctant to sign on initially, and it took several years of demonstrating the incredible success, the reduction of spend in the hospital, and now they are a very large supporter of the program. And it's a large hospital system, and for the life of me, I'm sorry, I cannot remember the name of it. Not that it's probably that important, but just the demonstration that once people truly understand, it's easy to get them engaged at that point. I think the hardest part is the initial, I'm going to use the word buy-in, the initial leap of faith. We certainly have taken that leap of faith at Choice and at CPAA. We've done our homework, done our research, and we know that this is going to bring good things to the counties that we're going to roll it out in initially.
And just to be clear, you might have mentioned this earlier in the presentation. If I missed it, I'm sorry. Is this evidence-based?
Yes. Yep. So it's both informed by the science from the Blue Zones, epidemiological study in partnership with Gallup on the well-being, the science of well-being. We advanced the simulation model at first that showed the correlation between reducing the risk profile and the disease prevalence and what that means for the economics of a community, medical cost savings, lost productivity savings, and regional economic impact. So the simulation model first, that got validated at the World Economic Forum. And then every single one of those 62 Blue Zone projects has come after that. Turns out we're always conservative when we come in and forecast what the medical cost savings are going to be, because every single one of those we've outperformed the initial cast for the economics. So in those two essences, it is very evidence-based.
Great.
Thank you.
You
Any
mentioned
other questions?
I'm sorry,
Dan?
you mentioned that it was you had a paper published in one of the medical journals. Would you mind posting that in the chat so we can review it?
You got it. And if you guys want, I can also post the Surgeon General report or the Deloitte report.
That'd be helpful. Thank you.
Okay. Any other questions? Okay, let's go to the health officer report. Dan?
Hi, everyone. It's good to see all of you guys. It's nice and balmy here in Minnesota. So really a lot of the stuff I've been working on right now has been really focused on the pandemic, of course. So we're starting to hopefully transition into the recovery phase. The numbers in our county have really have been staying active, and we've kind of plateaued in our cases. We're not really rising. We're not really falling right now, but we're definitely continuing on with the case and contact investigations with real focus on prevention still. We've stepped down our mass vaccination sites, and unfortunately we are at a lower rate of vaccine uptake than the rest of the state. But we're starting to see dwindling numbers. So a lot of our goals right now is to transition some of those efforts over to the hospital and up north. We are looking at kind of still evaluating for certain variants that are popping up in our area. Right now we've have some confirmed B117, which is the UK variant, which is now the predominant variant in Washington State, as well as we've had a report of the B1429, which is one of the California variants. But really kind of, as I was mentioning, we're kind of moving into this recovery phase. So a little bit of a focus on what this is going to mean for us moving forward. So I've been having meetings with the school superintendents on a consistent basis. Those have been stepped down until this summer, until we start to consider what the school next year is going to look like. And also in area command, there's been a lot of focus on what this means in terms of secondary outcomes and kind of what it means for mental health, substance abuse, and those kind of things. And so that's a lot of what I've been working on, and I'll hand it back to the board.
Any questions for Dan? Okay. So administration report. Thank you, Dan.
Well, busy couple of months. So we spent most of our time over the past couple of months working on the vaccine rollout, and it went very well here in Mason County. I included in your packet just a graph of how we did on vaccines over time. You'll see the big spikes. Those are the days we did our mass vaccination clinics, and I have to tell everybody I am so impressed with our staff, with our volunteers, with everybody that was involved with putting on those mass vax clinics. Up north we had a walk-in clinic. They're sponsored by Peninsula Community Health Systems, and then down here Mason General worked with us to do our drive-through clinic. And there are times in our drive-through clinic we were putting 6 cars through every 2.5 to 3 minutes. So it was just boom, boom, boom. We were getting them in, getting them out, having a lot of fun, got a lot of shots and a lot of arms. So we're up around 40,000 plus vaccinations out there administered. So figure roughly half of those for fully vaccinated. We've done a pretty good job with our over 65 crowd. We're about 60% on that population base. Our demand is diminishing. Our demand is going down. I think as people, we kind of hit the older folks. We opened it up then to the 19 and older, and now we're open up for the 12 to 18 category. So even with all that opening, I think what we're seeing is the people who want it have already gotten it. People who were very excited about getting the vaccine, man, they jumped in line right off the bat and they got it. And then we're working through a group of folks that they were kind of hesitant, but they came in. And we really kind of finished up that group as of last week, which was our last mass vaccination clinic, because we just don't have the demand for it at this point. So we're transitioning over to, like Dan said, using the hospitals, doing pop-up and mobile clinics, and going out to meet people where they are. We did get the list of the shut-ins, so that's being addressed as well, of people who are not able to make it in. And we shared those lists with our vaccination partners. So right now, it's going to be a matter of looking at populations and looking at gaps, and then picking those off one at a time and making sure we get to those. We got very little of the Johnson & Johnson product. So we didn't use that in the way that we had hoped to, which was to use that for, say, our populations that we don't get a chance to interact with that often, like our homeless population. It'd been nice to have a vaccine that was one and done for some of those groups, but we did move on with using the other two products, and we're getting the second shots in. So,
Hey, Dave.
Yeah.
Were you aware what's going on Friday with the National Guard in the hospital?
Yeah.
That's the one and done, right?
I think so, yeah. So I think the National, I haven't heard a lot of details on it, but I know the National Guard was coming in to do a clinic there at the hospital. So
it's Friday at the transit center. So
who's that for?
I'm sorry.
What population are they trying to target? Is it for guards?
Well, no, it's for anybody who wants it.
Okay.
They kind of centered the transit center, hoping they would get some of the transient population that runs through the downtown area. And with the one and done shots, it makes more sense to do that because they're not going to come back. But it's basically open to everyone Friday. The National Guard, I guess, contacted the hospital and said, what can we do to help? And here we're coming. So they even talked this morning about possibly sending, I guess you call them stringers, out to a food bank or anywhere that they get a group of people and they want them, they'll jump out of the transit center and head on out. So again, good things happening. And you know, like you said, Dave, your staff and the hospital staff is just phenomenal what they've gotten done.
So, like you're saying, we're rolling it out to our partners. Walmart and Safeway, I see both have signs up saying walk-ins, no appointment necessary for your COVID shots. Going forward into the fall, we have COVID now is allowed to be administered at the same time as you do childhood vaccines or other vaccines, so there's no longer that 30-day wait. So I think as we go into fall, we'll be better armed to do multiple things at the same time. We'll be able to do childhood vaccines and COVID. And who knows, they may even come out with a quadvalent flu vaccine that would include the COVID, but I haven't seen it, but I'm guessing that's probably in the works. So that's what I have for the vaccine rollout. Are there any questions?
No.
Okay. Phased recovery, changing all the time. So, since we start putting this thing together, we've been through multiple iterations of phased plans. So right now, all counties are in phase 3, and the governor has said once we reach 70% or June 30th, we're going to open up. So we had a conversation about that this morning with DOH. So is it 70% and a date, or 70% or a date? And it sounds like hit 70% and open, or a date. So but that could change, as things often do. Right now, as Dr. Stein said, in our county, we're looking pretty good. We have, I think we have 3 in the hospital right now, but we're still underneath our threshold, both for cases in the hospital and then cases per 100,000. So we're looking good as far as our phase recovery goes. Looking forward to a summer and getting back out and into having our nonprofits have the ability to go out and make some money. Last year they weren't able to do anything, and most have coasted over the past year. But our nonprofits really need to get back out and do those events where they can raise some funds. So that's kind of what I have on the phased recovery. My crystal ball is pretty small on that topic. So Next, I have the health officer search. So we have one candidate that we try to get an interview this week, and we could just not put a panel together and the person. So we'll be readdressing that. I'm also having a conversation with another health officer who's interested in possibly working for us on a contract basis. So that's another option that we're exploring tomorrow. So I will let the board know what we find. You know, it's kind of, if we can get another health officer for another county, that's goes along with the shared services concept that we've been trying to utilize a little bit. We've got Clark County right now is doing health officer duties across 5 counties. So we do have precedent for that kind of thing happening. So more to follow on that. And then lastly, I'd like to talk about the county health rankings. So the county health rankings came out, they kind of got ignored last year because everybody was in a panic over COVID, and was certainly the focus for the past 12 months. Going forward, I'm really going to start putting more emphasis on prevention, and that's one of the reasons I brought blue zones into this conversation. So with blue zones, right now, we haven't made the commitments yet, but we are looking to commit to at least the assessment piece to see if the community is ready for a blue zones project. And the funding is there to get that done. It's going to be informed by the county health rankings. So since 2016, Mason County has made progress every year in the county health rankings, with the exception of last year, and we kind of rolled back, so we started off at 30, I think 1 or 32, and we're up to 20, now we're back to 23. So that doesn't mean that we've slid. It could mean that other people are doing better and they moved up in the rankings. So you have to be careful looking at those rankings. And in fact, this year, you have to look for that number ranking, because what they did is they broke it into 4 pieces. So you're at the top, or you're the bottom, or you're one of the middle 2 pieces. So when you look at the county health rankings, they're split up into 2 parts: the health outcomes piece and the health factors piece. So health outcomes measures where we are right now, what we accomplished in the last year. And we did pretty well with the health outcomes. The biggest part of health outcomes are the years of life lost under 75. So if you take a person that, if we say 75 years old is the standard, and every year of life lost is somebody who dies at 65, that's 10 years of life lost. So, and they tally up all those things, and that gives a snapshot as to the outcomes of what we've done in Mason County. The other half of that is really around quality of life. So that's what we're talking about in blue zones. Poor or fair health, physical health, mental health, low birth weights are some of those factors that go into determining what our health outcomes look like. And lots of research going on around those. Health factors are the places where I'm really going to focus, because health factors are those things that set us up for success going forward in the future. So, and that's really where blue zones focuses. And I'll give you a couple of statistics here. So if we were to look at our adult smoking, we're at 18%. State's average is 12%. We've got some room to fix that. Obesity, this is startling, 37%. Top performers in the US are 26%. The Washington average is 29%, which is still bad. And we know that obesity and diabetes related diseases are those things that really affect the bottom line of all of us. That's what's killing us. Physical inactivity, access to exercise opportunities. I want to use this as an example of places where you have to be careful, because what they're measuring in access to exercise opportunities is, do you live within 5 miles of a gym? So we have walking trails and all kinds of other activities, but they're not measured in the county health rankings. So you have to be careful on that. Food insecurity, drug overdose deaths, all those things are things that we're looking at. As Darren Moody was saying, how do drug overdoses factor into this, and how does suicide factor in? How these other things? And I just pulled the data this morning, and suicides were actually, for Mason County, were kind of at a plateau last year, but our rates of overdose and other factors like that climbed quite a bit in the state as well. So looking at that, going forward, how do we influence that? Well, creating a healthy culture goes a long ways in doing that. When you look at those 7 communities you talked about around the world, they had a number of things in common. They're fairly homogenous. They had a shared religion or shared values. Those sorts of things don't directly apply into a kind of mixed community like we have in Shelton and in Mason County, Belfair and Hoodsport. But we can take those and move them still. So that's kind of where I'm going with county health rankings, looking at that kind of as just a snapshot of where we're at to set a tone going forward. I used to like to use these as a trends analysis, but they keep changing the measurements and the criteria. So it makes it very difficult to use the health rankings as a rate of change document. So that's where Melissa and the Blue Zones project come in, and really nailing down what's happening in the community and developing those trends over time analysis. So that's kind of the big things that's happening in my world right now. We did get some funding through the Foundation of Public Health Services. As you may or may not recall, in 2019, we got that piece of legislation written into law. That was a huge thing. That was 11 years of work there to get that done. And we were appropriated $28 million to implement that. Well, now going forward, the governor signed the budget, and we'll have $149 million per biennium on top of that to work on foundational public health system work. So I think I'm still on the committee, and I give up my chair of that committee next month, but I've been there for a long time, 11 years working on that. So we'll continue to work on getting that FTHS money allocated out to the counties to work on those things that really affect our health. That's kind of the big stuff right now.
Okay.
Question?
Any questions? Any questions for Dave? Okay, so I guess we'll move on to Alex. Is Alex on today?
I am. I'm here.
Okay.
Good afternoon, everybody. I've given you my EH report there for you to review. Just a few things to highlight on that. It's a bit of a broken record, I know, for these past few meetings, but permits still busy. No change in what we've been doing there. Just getting to a point of saturation with our staff. I mean, we're just overwhelmed with it all, and really working hard to keep those review times down and manageable to an acceptable level with the public. We've got about 3 to 4 staff that do work around drinking water and on-site sewage systems permitting, and they're just very busy. And relatable is that same 3 or 4 staff also deals with our enforcement issues. So we don't get a lot of dedicated funding for enforcement. In fact, there's only one real dedicated source, and that's with solid waste. And that accounts to about half a person every year, 1.5 FTE. So the amount of enforcement that we're dealing with right now is beyond what our one half person can deal with. On top of that, our enforcement in general is kind of peppered amongst the rest of our staff and all the other duties that they do throughout their day. So those are 2 things that we're struggling with right now. And we're working with the commission and trying to, working with Dave on trying to find some more funding sources to help us with additional staffing, to help us out with permits and solid waste. Other than that, some exciting news in our water quality program. We did get approval from the commission on May 11th with our single county-wide shellfish protection district, which is exciting. So basically what we've done with that is we've taken the 8 shellfish protection districts that we've created throughout the past several decades, and we've consolidated them into one, which will really help us just promote some efficiency within our department on the administration of these districts and the committees that go along with them, and will really help with that. And then in addition, they approved some financing mechanism, some local support that will help us give some reliable support in that program that's very much needed. Where before we were bouncing from grant project to grant project, it left crucial gaps in our staff, so it led to, staffing turnover, which, increases our costs in training and keeping, good, educated, experienced staff on for the public. This will really help with that. And I think the public will see that in that form too. I've had calls from the public where they're like, well, we just talked to somebody and it was a previous staff that, left there, months before. And so I think it'll just really help keep some experienced, educated staff within that program for cross training and then just keeping up in general water quality work that is much needed around here. Other than that, anybody have any questions on my report or what's going on?
Well, Alex, what's going on up there at the Hood Canal up by Hoodsport?
Yeah, I'll touch on that. So is one of our water quality projects, like I was just talking about, was our Hood Canal Regional PIC program. PIC is Pollution Identification and Correction. And that's been a 4-phase so far project that spanned across, I'm going to guess, about 5-6 years. Well, in the last several years, we've put efforts towards the reopening of Hoodsport, Shellfish growing area. And you guys might see some media articles coming out. The news is starting to hit the public that the Hoodsport area has been reopened for commercial shellfish harvesting. And that area has been closed and hasn't seen shellfish harvesting in 45 years. So it's a pretty big accomplishment. And the Hood Canal Coordinating Council helped fund that work. And the regional PIC program is really kind of a fun program to be a part of. It's a collaborative effort between various, it crosses county lines. So we've got Jefferson County Health Department, Kitsap Health Department, Mason Health Department, the various conservation districts involved, and then the tribes, and then we're all working together towards clean water in the Hood Canal. And so that's just an exciting accomplishment that's come out of that work.
Any other questions for Alex? Okay, guess we'll move on to Lydia then.
Good afternoon, everybody. So you've hopefully all been able to receive my report and read it. We always have lots to talk about from community family health. We have so many programs, but I guess happy to say that my staff pretty much with the end of the max vaccination and all the work, I don't know, that was a lot more work than people I think really understood behind the scenes. It would take us a good 40 hours to get ready for it, just all the paperwork and printing. But they're getting relief from that now and getting back to some of their regular duties after 15 months. And they're excited. Melissa's on right now with us, and she told me the other day, I feel like I'm at a new job because we literally hired her and she got immediately put into COVID and never got to really work on the job we hired her for. So she's getting to work on the community health improvement, and I'm excited for what's going to happen in the next months to years of that, especially hearing about the blue zones, which I thought was great to hear about. So anyway, they're all getting back to their regular jobs. Some had been working, continuing housing, of course, very busy during COVID, as well as our behavioral health work continued and was very busy during COVID. We never closed our doors here. Our staff was always working and very seldom from home. So they were real busy. They're glad to kind of be back to normal or feeling more back to normal. We still have a lot of COVID cases going on, as you heard Dave kind of mention. So we still have 3 people that are temporary workers that are still working on COVID cases, which is still helping our staff be able to do other work that they've gotten behind in over the past 15 months. So even catching up with our communicable disease things. So that's been kind of nice. Other than that, we recently wrote week before last, a team worked together on doing a CDC grant for prevention work for our prevention coalitions in Mason County. And so we won't hear about that until August, but pretty excited about that work. And I think that's basically all I have. If people don't have any questions, or if you have any questions about, we're just getting back, trying to get back to normal life here, and it feels refreshing. So.
Any
And
questions?
we're also putting together, Alex and I are working, and Dave putting together all the people that helped through this COVID response, so we can talk to the commission and the Board of Health and work with how are we going to show appreciation to all the help that was received through the community over the past 15 months. And it was a lot. So we had a great time with all volunteers and things too.
I think there's a lot of people that may need retraining after all this of what their job originally was, and they've forgotten the last 15 months.
Totally true. But it's the basis of public health, a pandemic response. So got to see it during my career. Not thrilled about it, but.
And let's hope never again.
Yeah.
Okay, any other questions for Lydia? Okay, other business.
So I
Any
guess
other business? Okay, Sharon.
All right, so the governor signed 1152, and that was the comprehensive health districts. The bill was thankfully pretty much gutted. And so truly did help Mason County. There are probably a few changes that we need to make to our board. We have to have, so you have to have equal number of folks on the board, elected and non-elected. And so we'll probably have to go through there. They said that they would like to have people who are in a variety of medical fields. I'll just put it that way, from medical, from epidemiologists to environmental health, to healthcare workers, physicians or osteopathic physicians. So there's quite a few registered nurses, dentists. Then they also go into tribal, and because we do have a couple of tribes in our county, those members will be appointed by, which one is it? It's the American Indian Health Commission. So we're going to have to reach out to them to see if we can get them to help us get a representative here. Basically, it's kind of like they followed Mason County's board. So who we have members for. I kept telling them Mason County was the one that they should follow the example of, and they kind of did. I don't know if it was because of me, but I'll just say it was.
Now we just have to get some non-elected officials.
Right. Some non-elected, and then we'll
members.
Take it from there. Yeah.
Okay. Yeah. So I guess we have to reach out to.
We've got the Health Coalition, so we have a lot of people that are involved already with us. So
right.
Invite them.
That might be a good group to look to.
Mm-hmm. And I've always thought we should have the tribes involved.
Right. Someone reached out from a tribe recently to me, and I thought I forwarded them to you, Dave. And it was, I think, from, I can't remember which of the two tribes it was that wanted to be on the Board of Health.
Oh, you're muted, Dave. You're still muted, Dave.
I hold it like that.
There you are.
Dave is muted. No, Lydia, I don't think I've seen that. I can go back and look, but I don't think I've seen that.
Okay, I'll go look again because I know someone reached out and they asked specifically about the Board of Health, and they were from one of the two tribes, and I was excited.
Yes.
So if I might, on the 1152, so Commissioner Trask is right. It basically took out all that stuff about regionalization, but it didn't take it out of the budget. And the governor signed the budget that allows, I think it's like $6 million or $6.5 million to explore regionalization and a new model of public health delivery?
Well, it does talk about a board that the governor will have. And that's a pretty large board. That's 4 representatives from local health jurisdictions. I mean, it's a large board. If I'll be surprised if they can get members to join that board. But I don't know. It's 2 pages worth of people that they want on their board. So it could still cost us. Things could still change. We'll just keep praying that it doesn't.
Okay. So Lydia, you're saying that we have people we can reach out to get.
Yeah, Melissa and I will, how about Melissa and I gather some parties some names and some who they're connected with in the community and submit those to the board.
That sounds great.
Okay.
Maybe somebody from PCHS or I don't know, because they're not elected.
You can have naturopaths.
We have tons of people on our list.
And
So
they
we'll,
also talk about, consumers of public health. So that's, people
Right.
People get WIC and things like that too. So,
And that would be a good addition.
yeah.
can you send me that list you're looking at, the description of what we're supposed to follow or be looking at?
It's 11:52. So what I'll do is I'll just
Okay,
type.
so just read it on 11:50.
Yeah. Well, I can just type it up and send it to you too.
Okay, all right.
Or you can read the bill. Either way, I'm good.
Okay, and is there a size? Is there a limit on size? Because obviously this thing could get pretty large.
Yeah.
Yeah. It could get very large. They just want to make sure that the people, that there's equal representation between the electeds and.
Between the two, right, okay. Okay.
Okay. So any other comments? Public comments?
I have a question on that one, though. An equal representation on elected versus non-elected. Are they basing it off what we had originally? If you remember originally, that's what we had was 3 county commissioners was the Board of Health. I pushed to change all that because it was ridiculous. Since the 2 commissioners that were attending had no clue what the heck we were talking about compared to all the people that were sitting in the room. So are they talking about that old model or the model that we're doing now?
Yeah, no, what they're talking about, the electeds that they refer to in this bill are the three county commissioners and city electeds. So if they're going by that, that's only 4.
Yeah.
So we could have
Yes, that's what we had originally was 3 county commissioners and 1 person from the city. And the 1 person from the city, I think back then wasn't there either. It was just me and 1 other commissioner, and we instead changed the structure to be what it is now. So I'm wondering if we're already in compliance, basically, because those were the other users. We chose for them to also be electeds, but they were the hospital districts and the like.
Yeah, we're pretty close to being compliant as already. I think what they would like to have is more folks from the consumers of
Yeah, we'll just have to look at it.
Yeah. So we're very close. I would say just a few tweaks and getting a tribal. See if we can get a tribal member on.
Does it stipulate that it has to be filled or just available? Because oftentimes, historically we've had a hard time filling that, and it sounds like maybe there's a person interested from one of the tribes, but we also have a seat for a provider, that we should be recruiting for. But I mean, is it that those seats have to be available, or I mean, what's the?
Yeah, we have to be able to offer the seat. So it doesn't say that we have to fill it, but it has to be available if we can get somebody to fill it.
So I have the information, and maybe Dave, you want to take this. Her name is Lindsay. She's from the Squaxin Island tribe, and I have a phone number, and she would like to be on the Board of Health.
Okay. So I think what we can do is, we'll work that, probably do an application and then come back to the July Board of Health meeting.
Okay.
Perfect. So is there any public on that would like to speak? Okay, hearing none, I would, can we adjourn? Can I get a motion to adjourn the meeting?
So moved.
Okay, second? All those in? Did I hear a second? Thought I did.
I'll second it if you didn't get one.
Okay, all those in favor? Aye.
Aye.
All those opposed? We're adjourned.